Hello, and welcome back to my channel. Thank you for joining me again this week on my journey with rheumatoid arthritis. This week, I wanted to talk about rheumatologists, those hopefully, those partners that help you on this journey with your autoimmune illness, your doctor. Um, I have a kind of a complicated relationship with the whole thought of rheumatologists. So let's get into it. With rheumatologists. Now I've had several rheumatologists throughout my journey with RA, and a lot of that has been due to me moving, or maybe my rheumatologist left their practice and I had to switch or whatever. But I've had 6 different rheumatologists so far in the 17 or 18 years that I've had RA. And they've all been different experiences, but almost also been the same. And I'll go into that a little bit. Um, One of the things that I look for now when I'm choosing a rheumatologist is their office setup, right? To me, I feel like it makes sense that your office should accommodate people who are coming in that may have pain, um, mobility issues, uh, difficulty using ink pens. Like, you are the place, right, where it is expected that someone's going to come into your office and they're going to have joint pain. You're the rheumatologist. And I want your office to reflect that appreciation back at me, right? When I go to the front desk, I want to see ink pens that are big and fat and easy for my hands to grip. You know what? Before I even get into your office, I want your door to either be handicap accessible or not made of some heavy wood that I've got to struggle to open. Like, these things introduce me to you as a doctor and how you view your patients and the challenges that they come with when they come to see you. I, I will not, that is a hill I would die on. I'm sorry. It just is. Like, that's who you should be. For any rheumatologist that might be looking at this video, please take note. We are evaluating you before we ever see your face. Just saying. Um, so that's kind of one of the things that I look for. Like, how's their office set up? When they call me back to the exam room, is the nurse or the assistant, are they practically jogging to the room and leaving me in their dust? Or are they accommodating their pace and walking with me um, to escort me to the room? Yeah, I mean, that's common courtesy. It's simple. It's acknowledging me as your patient, right? Um, when I get into the room and I'm talking to the rheumatologist, are they listening to me? Because this disease, and I assume probably all the autoimmune illnesses, come with so much more than just the disease, right? We're dealing with the the mental aspect of it, the mental health aspect of it. We're dealing with the chronic pain of it. We're dealing with lifestyle changes. We're dealing with, what does our nutrition need to look like? Can we follow these strict nutrition treatment plans? We're dealing with physical therapy. We're there's so much. There's so much. And I think a rheumatologist has to have the space, has to give you the space to not dump all of that, but to be comfortable expressing where you as the patient are at this point in your journey and what you might need, how they can assist you in those challenges and making things easier. Those are the basics. And I haven't even gotten to the treatments yet, right? That's the bedside manner. That's the relationship of it that I would hope a rheumatologist would would show to their patients, right? Um, and then with regard to actually treating um, the illness in the patient, I think one of the things that you should look for is options, right? A lot of rheumatologists, the first thing they want to do is whip out a pen and write you a prescription. That's it. They think the answer is medication, and that's it. Um, if they are holistic enough to also, not just monitor the medication and see how that's going, because that's obviously a very big part of it, but also see how you might take the suggestion of physical therapy if you're starting to experience mobility issues. Keep track of um, routine x-rays if they see that joints are starting to look and feel a bit different. Maybe get ahead of some things. Um, if you're finding that your joints are not functioning as well as you'd hope, right? You shouldn't be, as a patient, you should definitely be a partner in your care. I'm not saying you need to hand over everything to your doctor. However, you shouldn't always be the one asking for alternatives or supplemental treatments to just medication, right? That's something I think you should look for. Does your rheumatologist also offer you supplemental treatments outside of just medication? If they do, you might have a winner. Winner, winner, chicken dinner. Because that's not always been the case. Like I said, I've had 6 rheumatologists in my journey, and that has not always been the case. I've definitely had the ones that just whip out a prescription pad and we're done in 5 minutes. I cannot stand that. I think it's so inconsiderate. Um, so that would be my advice to you when you're looking for a rheumatologist. See what that relationship looks like, along with what, their credentials and how close your commute to their office. You may be good with it for now, but like, and if they're the best thing that you can find, and you've got to drive a little bit of a distance, you think it's worth it, go for it. But I found, as I got older and my mobility started to become a little bit more of a challenge, finding a rheumatologist that was closer to my home was very much worth it. So I took all of that into consideration. Um, so yeah, let me know in the comments, what has your journey been like looking for the rheumatologist that fit you perfectly, or at least well enough to help you feel like they were a partner in your journey? Have you found one? Um, this week's tip. This week's tip is a little controversial, but I don't care. I think it needs to be said, honestly. I have a very good relationship with my general practitioner. She knows my overall health. We talk. She knows all the things, right? For the most part, a general practitioner can do the same things a rheumatologist can do. Don't come for me. Don't come for me. But they can. If you find that you're just not getting what you need from your rheumatologist, I think, as a tip this week, you might think about having that discussion with your general practitioner, asking them, these are the things that I need to manage my rheumatoid arthritis or autoimmune illness. They can write a prescription. They can refer you to physical therapy. They can talk to you about your nutrition. They can order x-rays and tests. I don't know that there's anything a general practitioner can't do that a rheumatologist can. And if you have that level of comfort with your general practitioner and you just can't seem to find a rheumatologist that meets your level of expectation, that's my tip to you this week. Maybe you don't need a roomie. All right. Thank you so much for tuning in this week. I hope that you all have a great week and you feel good. Take care, and I'll see you next week.